zirconia treatment burr to divide my mesial and distal root. I'm going from the center of the drilling area that I performed previously, as I told you. And at this point, what is important is to notice the resistance of the tooth compared to the resistance of the bone. So as you're moving outwards from the center to the lingual aspect or the buccal aspect, you need to feel the different density. Once you fall into the low density, you need to stop because you don't want to over drill and overheat the bone, okay? That will induce even more bone resorption. So at this point, what I'm doing is I'm separating those supercrestal fibers using a 15C blade to separate that soft tissue from the remnant root in order to avoid damaging the soft tissue as I'm managing and I'm manipulating that root. So what I'm doing now, I'm using a periotome, and what I'm doing is trying to luxate and dislocate those roots into the interradicular space. As you can see, right in the center, you see that space. That's the space that you create in order to be able to move into the middle area those two roots. At some point, you need to feel that those roots seed a little bit. Just conceive and accept some kind of movement, at least some kind of micro movement. This brings specific atraumatic forceps. It's very, very usable and very easy to use because it's got some tips that actually, active tips that actually can engage the roots even if the roots are limited in terms of volume. And what I'm doing right now, I'm using my double luxating technique. I'm using a periotome on the lingual aspect. I'm all the time leaning on the bone. I'm trying to avoid touching the adjacent teeth. So every time